Hi, everyone. Welcome to the Place as Medicine podcast. This is a podcast where we talk about the relationship between our built environment, our homes, our cities, our neighborhoods, our towns, our land conservation areas, and our health, and some of these surprising connections that might not always be obvious to us. I'm very excited today. I am joined by Devon Giordano, who's the executive director of the Long Island Conservancy. She and I have gotten to know each other over a couple of years when she was at the Nature Conservancy, where I'm a New York board member. We also have Dr. Donahoe, who's the director of Ambulatory Cardiac Research at Northwell Health on Long Island. And the two of them, this is our first podcast with two guests. So this will be very fun to kind of moderate this conversation between the two of them. One, a leader in conservation and thinking about nature and how to preserve natural spaces and get people out in nature, especially kids. And then Dr. Donahoe, who's focused a lot on health and cardiac health in particular. And this is Heart Month, February, so Valentine's Day, it's very relevant. And so this will be a fun kind of conversation dialogue between the two of them. So I'm very excited about that. So welcome to both of you.
Thanks, Carrie, for having us.
So I guess we can start off with Devon. In a couple sentences, just share a little bit about who you are, your background, and what brings you to this intersection between health and place.
Yeah, absolutely. Thanks. So thanks for having me first off. It's so great to be working with you again in my new capacity at the Long Island Conservancy. So I've been at the Long Island Conservancy now for just a little under a half a year. My background before this was as you mentioned, at the Nature Conservancy, focusing on the environment, climate resilience, and one thing that I've always found, and I should say that before that, my focus was on global affairs and international peace and conflict resolution. And what kept happening was, as I was living around the world, working with entities such as the European Union and the United Nations, a lot of global conflicts, not all, but a lot, I was noticing there was some sort of connection with climate pressure. And, over and over again, I kept feeling this. And, I realized that for my own fulfillment in my career, I needed to go into the environmental sector. And, hence when I started to work with the Nature Conservancy. And then even more so recently, I'm obviously a native Long Islander, born in Brooklyn, which is technically on it's one of the boroughs, but it's on Long Island. And, Long Island is one of the top most populated islands on the planet. So what we do here very much very much matters and has implications globally. Obviously, I'm slightly biased because I live here. I'm raising my children here, and I'm seeing the effects of climate change, in my everyday life. In water quality, the Great South Bay is right down the block from where I live, and I have woodlands near me. I'm very fortunate that I have that, but more needs to be done. Not just for Long Islanders, but also for the planet at large. There are a lot of opportunities, but also a lot of challenges. And that's what the Long Island Conservancy is addressing.
That's great. And we'll get more into it as we go into the rest of the podcast. But Dr. Donahoe, tell me a little bit about you. Tell the audience a bit and what you're focused on and how you start to think about nature in your work.
Yeah, thanks, Carrie, for the introduction. And so, as Devon said, I'm also a native Long Islander. I grew up on the South Shore of Long Island, also near the Great South Bay there, and spent a lot of time on Fire Island. So we're familiar with the same territory there. I completed my medical training in New York and Boston. I went to NYU for New York University School of Medicine for my MD degree, and I completed my residency in internal medicine in Boston, and then I returned for a cardiology fellowship at Weill Cornell. But I have returned to greener spaces on the east end of Long Island here. I have been practicing on the east end of Long Island for the last 15 plus years between Hampton Bays, Riverhead, Southampton, and have been an attending physician at Peconic Bay Medical Center and joined Northwell Health about 10 years ago. And my focus in cardiology is mostly on preventive cardiology. So I look forward to having a discussion about, because obviously lifestyle measures are sort of paramount when we talk about prevention. And so I look forward to our discussion.
Yeah, and I guess for both of you, well, I guess first of all, maybe stepping back, Dr. Donahoe, from your lens as a clinician, how do you define the connection between the built environment, natural environment, and human health? How do you think about those things? That's a big question.
Yeah, so as we were talking about before, that lifestyle is obviously a major part of cardiovascular health, and typically when we think about lifestyle, we think about diet and exercise. And there's the old expression, it goes back to, I think, Hippocrates initially, who said, food is thy medicine. And exercise also is also thought of as the best medicine. But nature obviously is part of the picture there, and I think it's something that we all recognize, but it's overlooked. And I could, me myself, I would say that I don't feel like I spend enough time outdoors, and I think that this is sort of a ripe opportunity to improve our own personal and as well as my patients' outcomes.
And when did you both, either of you guys can answer this question, but when did you first realize, like on your own path, that did either of you have a moment where you thought, wow, being out in nature or something about my built environment is impacting my health? I think I've had my own story there of realizing it, and also realizing the lack of education I had around the built environment and nature and the health impacts. But I'm curious if either of you kind of had a light bulb moment that has helped get you more into this field or supercharged your work in some way.
Want to go ahead, doctor?
Sure. So, I think, probably for me, it's probably with the COVID pandemic. I think, all of us were, well, in between, watching sort of the news updates and being stranded at home, we were sort of walking around our neighborhood. And I think, that was obviously a stressful time as a person and as a provider. And I think that's probably where the light bulb moment was for me, just walking around the neighborhood and sort of seeing neighbors that I actually probably had never seen before walking, at least over 6 feet away across the other side of the street. And, just the importance of sort of integrating that into our health because it's a win-win-win for us, right? That being involved in nature, it's important for our physical health, which we can get into, but it's important for our mental health as well as our social health.
Yeah. I'm excited to jump into that. But Devon, maybe you give us a sense of like this light bulb moment for you and your work.
Yeah, it's funny. So I've felt it, I think, without realizing it since for as long as I can remember. But I do distinctly remember, coming of age in my teenage years and in my 20s, and I would go for a run outside. I ran cross country. I'd go for a run outside through the woods, and I just always, or I would go skiing, and I'd always just, feel healthier after. And I think I was too young to really name it. However, now being a mother and also, working here at the Long Island Conservancy, where we work with youth in nature, I'm finally able to really see it from more of an outside perspective. Where, just about a year ago, I took my son on a run. He was trying out for the middle school cross country team. He said, "Okay, yeah, I'll go run with you, Mom." And we're just running down the street, and he's like, "Oh, I'm bored. Oh, I want to walk again." I said, "You know what? There's a preserve over there. Why don't we go for a run through the trails?" It's like that. And he was like, "Wow." And he turned to me, he goes, "I just feel so alive when I'm running through the woods. This is so much fun." And, it's like, Yes, that really, you really do see the connection between just energy and the smile. And listen, the woods aren't for everybody. I very much acknowledge that. But even recently, same age group, we were doing an invasive species removal day with a bunch of middle schoolers, and it was middle schoolers who don't traditionally have access to nature. And through some great partnerships, we were able to get these kids who were struggling with some mental health issues, and sadly even at this young age some in recovery from addiction issues, and said, okay, come on, we're getting our hands dirty, let's get out, let's start pulling up weeds. Winter's the perfect time to get outside and pull up weeds. In the winter, youth can be at risk for if they're struggling for mental health, at depression. So we're getting outside. And one of the kids turned to me after a few hours, and he was nervous, he was very apprehensive. At the beginning of the day, he's like, I've never done anything like this before, like I don't. And at the end of the day, he turned to me, he goes, wow. He goes, I know, this might sound a little cheesy, but or he probably used a Gen Alpha term that I didn't get, but he said, but he's like, I didn't know that nature would make me feel this alive so fast. And that was really like a, oh my gosh, what we're feeling intuitively, that's real. That's real.
I'm so glad you. Yeah, go for it.
Sorry, guys. Working the 3-person here. Just to dovetail, off that point there, and you're referring to, to adolescents or preteens there. I think, the beauty of this is that the effect is universal, right? And that I can sort of tell you the same thing about my octogenarians, that I see here. And really, that's like I said, the magic of this here. That it benefits everyone, and has those diverse benefits. And the other part is I've never heard anyone say that they regretted it afterwards, right? I've never heard anyone come back and say, "Oh, why'd you recommend that?" Or why did I do that? And when I think about medicine, and all of medicine is risks and benefits. And you're starting a medication, you're starting a cholesterol medication, you're recommending a procedure. What's the right? To me, this is all a win. It's all benefit with very little risk. Again, maybe the dermatologists and orthopedics will yell at me about sun exposure and overuse of joints or so, activity. But with normal activity, in an outdoor environment, there is very, very little risk.
Amazing.
And tick-borne disease protection on the East End.
Yes, that's another one for Long Island.
Yeah,
so tell us.
I can go into that a little, actually, what we're doing for that.
Dr. Donahoe, tell us a little bit about the core mechanisms of nature that support health. You alluded to the mind, body, different things, but just lay it out for people to get a sense.
I think, Carrie, the short answer is I don't think we have all the answers. I think, are there absolutely major studies demonstrating hemodynamic benefits and lower blood pressure and improvement in heart rate and improvement in metabolics? Yes. Are there data out there and just demonstrating overall improvement in mortality? Yes. And then if you look at some of the biochemical analysis, you can look that there's decrease in cortisol levels of stress hormones, and that there's an improvement in an immune response. And and at the end of the day, the immunity, which is sort of such a very hot topic right now in preventive cardiology, that may be the link of all of this here, because obviously that touches kind of all organ systems. But it's not just one thing, and I come back to, I'm talking about, when I'm talking about cortisol and immunity and blood pressure, I'm talking about the physical effects. But again, I as Devon was talking about before, sort of the psychological, effects of this, and in terms of improvement in mental health and reducing anxiety and improving depression, and then the concept of socialization and just there's a big concern about loneliness and the avoidance of isolation. And again, talking more about my population, that is a very important part of this, of getting out there and being outdoors and being part of a community outside.
Tell us more about that. Tell us a little bit about your population in particular and how you think about that.
Yeah. So again, my primary role is as a preventive cardiologist, and so when we talk about prevention, we talk about primary prevention, secondary prevention, to break it down. And so primary prevention is somebody who has not had an event yet and trying to prevent their initial event. But all too often, we meet people in cardiology more in the secondary prevention realm, where they've had their event and they're obviously at higher risk, and we're trying to prevent the next event. And because again, the fact that they've already declared themselves that they've had a cardiac event, and so that's why they're at a higher risk, and that's why we're more aggressive about risk factors. And I want to be clear here. Medications are the cornerstone a lot of what we do in terms of using blood thinners after somebody has a procedure, using cholesterol medications to improve their metabolics, controlling their blood pressure. But lifestyle is just such an important adjunct to this. And so the American Heart Association talks about the essential 8. Actually, it used to be the essential 7, but now it's the essential 8. And there are those parts that I referred to before in terms of lowering blood pressure, lowering sugar, lowering cholesterol. But then there are the lifestyle components of a healthy diet, exercise, proper sleep, weight, and by the way, and then smoking is the last one for the 8th there. Sleep was the recent addition to this. And so just getting into the details of the physical activity of this, what the American Heart Association recommends is 150 minutes of moderate activity. And moderate activity is defined as, getting your heart rate up, but still being able to talk. With that, they also define vigorous activity, doing 75 minutes where, there you're really getting your heart rate up and not being able to talk. But the majority of our recommendation is for that moderate activity. And that's where being involved in nature is perfect. That's where we talk about, hiking on the trails or walking on the beach or doing gardening. That is the perfect activity for moderate activity. And, it's, easy to accomplish 150 minutes of that, when you get yourself into the right path.
Yeah. And what I want to talk about later is a little bit of how do you incentivize that? How do you get people outdoors? Are you doing prescriptions for health? What are the barriers? Well, I definitely want to make sure we leave time for that. I think before we jump into that, Devon, we really jumped into what Long Island Conservancy does, but maybe step back and really do explain, like, what is the breadth of the organization? How do you think about it? And how does health fit in? And I know there's so many elements of it, not just, getting people out of nature, but a lot of what you do is about is protection for water and making sure there's water, good water quality on Long Island. So tell us, let's just take a step back for a second and tell us a little bit about Long Island Conservancy.
Yeah, absolutely. So the main mission of Long Island Conservancy is to restore the ecosystems on Long Island, all the way from the East River to Montauk Point. So we do this primarily through native plantings, invasive species removal, conserving small pockets of land in residential areas, ensuring access for everyone. It's not, this faraway preserve that you need a car to get to, or, really making it, equitable for all Long Islanders. And so, many people may or may not know if they're not from Long Island, but Long Island has a sole source aquifer. So everything we do, what we plant, how we manage our landscapes, how we manage our wetlands directly affects the water that we drink. So when our ecosystems are stressed, we feel it. Plus, loss of tree canopy, native habitat, that increases, loss of native habitat increases heat, it increases flooding, it increases stress. So when we talk about stewardship of our lands and waters, we're not just talking about something abstract, but rather we're talking about the conditions that shape our daily well-being: clean water, breathable air, places to move our bodies, the landscapes that reduce our stress. So healthy ecosystems really help to create healthier people.
Yeah. And give a sense, I mean, one of our earlier conversations, we talked about some of the challenges that Long Island actually faces, a lot of it having to do with this aquifer and water quality in particular. But give a sense of why this is so important. Like, what are the challenges you are currently facing health wise on Long Island?
Oh yeah. I mean, we have high cancer rates on Long Island. And listen, I'm not a doctor, there is a lot of research that still needs to be done with the connection. And, this is also something that, we had also chatted about, kind of like the silos between the health sector and nature. And I'm hoping that, conversations such as these start to break down those silos, because it is important. We are, as I said earlier, we're one of the most one of the, obviously Manhattan is a very populated island as well. But we are one of the top 10 most populated islands when you include Brooklyn and Queens. And so, what we do here will set an example of how you can have a highly populated island and still have sustainability and healthy ecosystems. So, you know, um, there are ways to help improve our health, and in terms, through our ecosystem restoration, native plantings. What many people don't notice, like, I don't think anyone's going out in their backyard and saying, you know what, I'm going to go and plant burning bush because it's going to kill this ecosystem, and that's what I want to do. Like, nobody's doing that. People are like, "Oh, that looks beautiful." Yeah, it does. Sure, I get it, but I think that education would really help people. When you plant a native plant, like an American chestnut tree in your backyard, as opposed to an invasive plant such as a burning bush, native trees and native plants, their root system goes down much, much deeper than invasive species. What that does is it naturally filters our water system. It naturally resets the pH balance in our soil, which then helps our, not just our water that we're drinking, but also the air that we're breathing. So you can make a difference. Just, I know sometimes it feels overwhelming. You hear all this stuff in the news. It's like, I just want to give up. Like, what can I do? You can make a difference in your own backyard by what you're planting and educating yourself. But like I said, no one goes into planting trees in their backyard thinking that they're killing the environment. There's such a lack of education out there of what you're planting, what you're using to fertilize, how that affects your health. And that's something that LIC is really trying to combat. But there is a lot of lack of information out there.
Are there good resources for people to turn to for this type of information?
Yeah, so LIC is so there aren't, I should say, there aren't currently. There is starting to become more and more resources available, and that's something that we're obviously working hard. So, go onto the Long Island Conservancy website. You can look up the Dirty Dozen, and you'll see, wait till you see some of the plants that are considered the most invasive. You'll be like, oh my goodness, I didn't even know I just planted that. I can't tell you how many people are like, oh my gosh, I had no idea. So I would definitely, go on to the DEC website, dec.gov, go on to longislandconservancy.org. You can go on to, Long Island Native Plants. A lot of our partner organizations are really trying to get the information out there, but there is a critical lack of information, which we're trying to overcome.
Yeah, this is fun because there's so many interesting themes that are being woven together here. And just a plug that a podcast we did in the fall with a dear friend of mine, Kate Hayes, who's a landscape architect. She talked a lot about native plants and about the importance of them and how they've co-evolved with the landscape, kind of, Devon, as you alluded to, and just in ways that are just very helpful for the entire ecosystem, health, biodiversity. So that's definitely worth a listen. And she pointed to a few resources for people, especially in California, and some cool stuff there. Yeah, I love all the layers that we're getting at here. I think kind of shifting back, but Devon, thank you, because you helped paint the picture that, all of these different systems are connected. Like literally, the tree you choose in your backyard, in a place like Long Island, where it's groundwater that's being used in your faucet. That does play a role in the quality of water that you have versus is it covered in pesticides on the golf course nearby. So there is this like a full linkage of nature and health, but then nature and health also as the cure potentially. So Dr. Donahoe, I'd love to get from you a couple stories or examples about some patients, obviously without their names, we don't need to know that, but where you've seen some, really interesting improvements or whatnot with them and getting out in nature.
Yeah, no, sure. And just to, yeah, no, this has actually been really kind of eye-opening here, and I'm afraid to look up the Dirty Dozen to see what my backyard looks like here, Devin. And I think, and just before I go into the patient stories, I think the same theme that we're just getting over and over again is just the all, I guess, all the different exposures, and I think this is a big sort of another topic in preventive cardiology right now, just the environmental exposures. Microplastics and obviously air pollution, but the other exposures with pesticides here. So it's very eye-opening and a little bit frightening to be thinking about all these things. To sort of come back to sort of patient stories here, and again in my clinical practice, I see a variety of patients of different severity of disease, different demographics, different age. But I think just, sort of one general theme that has struck me over the years here is sort of what is the secret sauce to longevity? What's the common theme, that you see in these, these healthy agers or super agers, I think is the term that's kind of thrown out there. And, the thing that I see over and over again, on these folks is that one, they have a purpose, and two, that they're active. And when I say they're active, in terms of being physically active, and socially active, and and mentally active, whether or not that's still working or playing, being part of a card group, but that's when I see, my octogenarians, my 80-year-olds, my 90-year-olds, who are thriving. I find that it's always comes back to that. So now sort of to deep dive in and sort of give you an example of a patient who immediately comes to mind when you ask this is I had seen a younger guy, and I'll call him younger now that I entered my 50s, who had a cardiac event. And he had his cardiac event because, unfortunately, just life was too busy to take care of himself, and he was busy with a young family, and he's active with work and not doing any regular exercise, and just kind of let things gone, over the years here. And he had gotten taken care of in our local hospital, and I had seen him in cardiology follow-up. We talked about his new medications and lifestyle measures, and I had referred him to our cardiac rehab program. And so what cardiac rehab is sort of a structured exercise program. It's an outpatient program, which gets somebody into, the right types of, it's a comprehensive program of diet and physical activity and going over the medications, and has wonderful data behind it in terms of reducing cardiovascular risk. It keeps people out of the hospital. It makes them feel better. It reduces cardiovascular mortality. And he was a perfect candidate for him because he just needed to get on the right track here. And part of it is there's accountability. Like there's somebody waiting for you at the cardiac rehab. You have to be there at 9 o'clock. It's not like, oh yeah, I'll go to the gym later. I'll go for a walk later. You know, you got to be there. And so you got to sort of carve the time out for it. And so he went through the cardiac rehab program and did very well in the program. Typically, a cardiac rehab program is 2 to 3 times a week over 12 weeks, about 40 sessions. And really, you know, with that, he sort of broke the inertia, and he got excited about about doing exercise. And, you know, basically every time I would see him, he would tell me about his streak, you know, that he was doing of walking on the beach out here. And, you know, he would do this, you know, rain or shine, winter or summer, although I haven't seen him recently. So I don't know if the recent snowstorms that we've had out here and what the beach looks like, you know, what his streak is up to. But you know, I think he just sort of highlights, you know, this sort of integration of, you know, being physically active, being out there in nature, you know, and improving health outcomes.
And do you generally, is the easiest barrier to entry just walking, hey, walk outside? Or do you often try to suggest other avenues for people? And what kind of frictions do you see when you do suggest outdoor interventions?
Right. So I think the most important thing is I tell patients to do what they like, you know, because it really, and there was an actually a little controversial study that got picked up on a bunch of media platforms about different types of exercise. But really, what I thought was lost in the big media message there was that any amount of activity reduces cardiovascular risk and reduces cardiovascular mortality. And there was actually a subsequent study that said even 5 to 10 minutes, you know, which is not I mean, that's kind of almost activities of daily living, reduces cardiovascular risk. So that's the first part of the message is to, you know, you enjoy, you know, doing Zumba, do Zumba. You want to go hula hooping, go hula hooping. You want to walk, like to do something that they enjoy. And, you know, it comes back to this, you know, idea of being physically active. And, you know, Sir Isaac Newton, you know, a body in motion stays in motion, you know, and a body at rest stays at rest here. And it's just so important in terms of reducing cardiovascular risk.
Yeah. Devon, listening to this, I'm curious what you're thinking, and especially some of the programs you guys run and how you think about that. So I'm just curious your reaction.
Yeah, absolutely. You know, because I do agree, but what keeps entering my mind is two things. One, um, you know, to think of someone walking down the beach and, you know, those of us who have you know, are fortunate enough to live by water, you know, it really, you know, you know, as Dr. Donahoe was saying, no one goes outside and goes for a walk and it's like, oh, I really regretted that. You know, it's usually, you know, generally speaking, it's usually a positive experience. But, you know, I can't help to think that it's only going to be so healthy as our environment. And if we don't protect our environment and our clean air and clean water, that's not going to be very healthy. Walking next to a polluted stream with, you know, algal blooms and breathing in the vapors from the algal blooms, or watching, you know, just, you know, invasive Phragmites overrun a pond and, you know, a green smudge on it, you know, that's not going to feel very healthy. So if we don't protect our environment, we're just, you know, we're not protecting our own health. You know, that's one. And the second thing that keeps going through my mind is, you know, what we kind of touched on earlier, which is not everyone has access to these green spaces. And it just feels very inequitable. And you know, as you drive around, you know, various neighborhoods in Long Island, it's you really can see the disparities of who has access to nature and who doesn't. And that's something that Long Island Conservancy is very much trying to change. And, you know, as I was saying a bit earlier, we're really trying to create even, small pockets of nature in all neighborhoods, so that everyone has this access to walk through a tree canopy, or at the very least tree lined streets, and to just kind of feel those beneficial effects, that whether they realize it or not, whether they have that aha moment like the middle schooler I worked with a few months ago, or even like myself and some colleagues, where it's just this intuitive, and that you can't put your finger on it. So yeah, that's what keeps resonating for me.
And one thing that I think is worth raising, you talk about affordability, and I do think that's a pretty critical point, and also just access, like the ability to take the time to be outside, et cetera. But I think it would be helpful to touch upon a little bit with your work, Devon. You know, often a pushback I get with some of the these podcasts or with Instagram is, especially with conservation, is, oh, you're taking away land and you're planting trees on it that could be used for housing, which is a perfectly reasonable thing to say, and it makes sense. But in many cases, we're talking about tree canopy on existing street right of ways. You're not taking any land. And in your case, what you had shared with me was a lot of what you guys are doing is restoring or working with the state or the county to actually make their public parks better. So share a little bit about that and some of those successes you've had.
Yeah, absolutely. That's great. And yeah, there's one particular project I'd love to share with you, but just to touch on, the affordable housing. We are very much advocates for that. But what we want is, for the folks who come and are, living in this affordable housing, we still want them to have trees around them, like you said, on streets, or even just a small lot for them to go outside and sit on a bench right next to their new apartment, that's or new home. We want to really enhance that experience, not replace it. But yeah, so we're working in West Hills County Park in Huntington, which is it's the total acreage. I actually don't remember offhand. It's many acres, but what we're working on right now is in particular is 8 acres right there in the park, where it is overrun with invasive species, to the point where the trails, the existing trails, are near tripping over invasive roots. And so a couple of the plants that we're really working to remove there, one um, is English ivy. So this is a big misconception, but I know everyone thinks of Long Island and the deer ticks, and how, oh, there are deer here, there must be ticks. But actually, the vectors for ticks and Lyme's disease come from the white-footed mouse. And the white-footed mouse, their population is at an all-time high because of the invasive species English ivy, which has been blanketing our public parks. And so therefore the mice hide underneath the blanket of English ivy, and the predators can't find them. The hawks and the owls aren't able to find them. And that is why Lyme's disease is really just, and then, obviously they travel on the deer. But so one of the big projects we're working on there is removing the English ivy from there. And then, you walk through, you see the English ivy, they're suffocating the trees, and the trees are dying. Another one is Tree of Heaven. So Tree of Heaven, listen, it's called Tree of Heaven. It's beautiful. Tree of Heaven is actually the breeding ground for these red lanternflies, which I know have been all over the news. And you're taught, if you see one, squash them, yeah, do it. But if we could remove the Tree of Heaven, which Long Island Conservancy is doing, if we could remove all of them, that would really mitigate, the lanternflies. Same with, all what they're feeding on. And what happens is when they eat these invasive plants, it makes it so they become poisonous to their predators. So we could really double time, all this. So that's one of the projects. And we're doing, we're partnering with youth groups. A lot of this invasive species removal, there are, it could be backbreaking work. So we're partnering with a lot of teenagers. Boy Scouts are really into, coming and helping us with these. But, it's every acre at a time. So far, in our short time of existence, we've been able to restore over 150 acres. At the beginning of the year, we're poised to more than double that number. It looks like we're actually going to blow that out of the park. And it's shocking. There's a lot of opportunity and challenges there's just so many invasive species on Long Island, and it's a lot of work, but it's worth it.
Well, and it speaks to, I think, the obvious partnership here, which I want you guys to talk more about, is, getting rid of these invasives involves people. It's great for people to be in nature. Like, there is this really nice combination here that's happening, among other ways people can get out in nature and feel good. So I'm curious, I'm curious how each of you are thinking about partnering, not necessarily with the other directly, but how do you, Dr. Donahoe, think about working with conservancies, or, Devon, how do you think about partnering with healthcare systems? So I'm curious what how you respond to that.
Yeah, no, it's a great question. And, and because, we talk about a lot of the same themes in healthcare, social determinants of health. And obviously, as you mentioned, how that's a challenge to green spaces, and it's obviously a challenge in healthcare as well. And, you also mentioned before, Carrie, about just silos, right? And that we live in our own silos. And I say, even in medicine, we live in our own silos. That cardiology is in a different silo than surgery. And so I really think it comes down to, it comes down to, breaking, those silos down, and sort of, I guess, opportunities like this to cross communicate and to make these connections, because, I think we all ultimately want the same goal here. And, we're fighting our different battles, and, how can we, synergize these efforts?
So when you're prescribing, in the cardiac rehab post event, what have you found is the stickiest for people to get them to start to shift their lifestyle and be more active? Is it recommending something that's outdoors because you have, the beauty of walking, or is it being in a group, or is it really just something that they love? I'm just trying to understand do you see a measurable benefit in a prescription for a walk outdoors versus a walk on a treadmill?
Oh, yeah. Okay, great. Yeah, no, I think there absolutely, is that benefit of being outdoors, as long as we stay away from that scary algae that Devon was talking about before, sort of envisioning the pond as she was describing it.
I know. Very visceral.
Very good though. But I think the right way to answer this, again, is coming back to, one, what they enjoy, but two is the social network of it here, and it being a team effort, and with that, I mean, I'll say, even, me myself, trying to multitask, it's not, uncommon that when I do my walks, I'm, listening to a lecture or listening to a podcast, and trying to accomplish two. Although I do think it's probably more refreshing to, take the AirPods out of my ear and hear the bird song. But, it comes down to ultimately, and the other part of it is, just everyone's so busy, right? Everyone's so busy. Everyone's connected. You always have your device on. It's kind of easier to kind of scroll and see what's going on social media. And I think it really comes down to and part of why I think there is an advantage of it being a team effort is it builds in that accountability. That rehab where somebody's waiting for you to come at 9:00. Okay, hey, listen, let's go meet and walk at the beach at 8:00, right? And I think that's kind of the advantage, to doing that, because it's easy to blow off when you say, oh, am I going to go downstairs and go on my treadmill?
Yeah, so it's definitely, I'd say probably parroting community. It's like that fun excitement element to it. And then it's where is that best done? Is it walking next to each other on a treadmill, or is it walking next to each other on a beach, something like that?
Yeah, me myself having a dog here, that's definitely a good excuse to get together, and also get the energy, out of the dogs here. And there is definitely a loneliness epidemic out there, especially as people get older, and if they live alone. And so I really do think that making these efforts are important in terms of avoiding social isolation.
And then Devon, just kind of teeing you up, like you've mentioned, potentially partnering with healthcare systems for things like employee volunteer days, guided hikes, backyard gardening. Like, tell me a little bit more about that. That's very interesting.
Yeah, yeah. You know what? Although I have to say, as Dr. Donahoe was talking, it just kind of gave me an idea. I wonder, yeah, because we do, we'll do employee volunteer days. We go out in the community. We'll plant pollinator gardens at hospitals and, both for the patients and for the employees. But it just got me thinking that I wonder if there's an opportunity to do, a partnership with a hospital to 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 plan like an organized meetup for some of these groups where it could, and there could be levels, and almost like prescribed, like, okay, 10-minute walk through this, paved trail where you're with others. And because I do think that there is accountability. If you make a plan to go with a friend or you sign up for a meetup, there is that extra outside motivation to get you out there, because it is just so easy to blow it off, just, oh, I'll do it later. So I think that there is, avenues, and even just helping doctors and hospital systems identify, because we're in the nature business, we're in the preserve business, so we know where the trails are. And once again, I know woods aren't for everyone, so it could be, well, here's a nice, boardwalk route, or here's there's a nice small garden behind this bus stop in that town where we could kind of identify some flat, accessible ground for some light walking.
Yeah, no, that's really helpful. I'm thinking, just for folks listening, what are, and I'm sure people have kind of picked up on things already, but in case it hasn't been, packaged up and abundantly obvious, like what are a couple things that you guys think that listeners could do, this week, this month, maybe in the summer, that would, measurably improve their health in some way, or measurably improve their environment around them, which then in turn improves their health? Are there some tangible things people can walk away with?
Yeah, well, I would
No pun
start.
intended.
Yeah, right. Yeah, exactly. I mean, I would start, listen, let's not make it overwhelming for people. If this is new for someone, even just starting on your own property, in your own backyard, going outside, start learning about what's in your own backyard that, perhaps you could plant that will attract pollinators and monarch butterflies. What might you need to remove that is increasing the lanternfly population or the tick population? And even something as small as that, getting down and digging a hole, that's some light movement, digging a hole. Like, it doesn't have, we're not asking, people to go out and start removing trees. Like, please be safe. Obviously talk to your doctor first, make sure you're cleared for this activity. But going for a walk outside of the perimeter of your property, doing some digging, you're getting some arm work. I mean, I know when I am digging holes to plant flowers, I feel it, I feel it. So, yeah, in that way, you're not just helping, the environment right here at home, but you're also helping your health by moving around a little bit.
And Dr. Donahoe, what do you think on your side? You've given a lot of suggestions, but anything that folks might have missed, or maybe it can be even like less active, more quiet, or more just
Yeah,
being outside.
funny, Carrie. I was actually, I was thinking exactly that point. That there is value, in the quiet too, of like I mentioned before, of, hearing the bird song, or, just sitting outside and, just, reflective time, I guess, or, being outdoors, that because there obviously is this component of, mental health, mental health overall, but mental health as a risk factor for cardiovascular disease, in my world here. So I think there's value in that, in addition, to the physical in addition to the physical activity, and I just, listening to, Devon here, I kind of, what keeps coming back to me here is I think about how sort of nature works to keep us healthy, and sort of how do we kind of need to work to keep nature healthy, and sort of, how you mentioned this is kind of the first time of a three person, conversation here, but it was actually a lot of fun sort of hearing Devon's perspective on this, because I think, we're sort of we're preaching similar things from a different perspective.
Yeah, and it is fun having you guys both on, and I'm wondering, like, just having each other here, what's something you would hope out of each other's professions to start to make these connections, because they are really profound. They're there. We have different systems of how we, have health insurance and those incentives, and then we have different systems for how we think about land use and paying for parks, and that's a whole tax bucket, and philanthropy, and they're very distinct systems. And I actually recently moderated a similar type panel with the Nature Conservancy a few weeks ago, and my thought was really, well, these are both somewhat technical fields, conservation and medicine, and so it is hard for the sides to, like, they're so complex to understand in general, and then once you get that, then it's speaking to across the aisle to these different groups is challenging. So just since we are in this podcast right now, like, what are some things and hopes you guys would have for your fields, and how you start to integrate, and also, like, venues and moments and ways to do that? So that's a big question, but since you're both here,
Yeah.
Devon, maybe start with you.
Yeah, this is just a great example of how we can work together. It's conversations like these. And there are so many opportunities, where if we're doing a conference that's focused on conservation, there's no reason why we should not bring a medical doctor for one of the panels to talk about that connection. We really can find little opportunities to intersect, and that's how it happens. Just those small areas of intersection just start to kind of to spread, and before you know it, it will become just common thought practice to connect it.
Mm-hmm, mm-hmm. Dr. Donahoe, what are your thoughts here on how we can start to knit this a little bit more?
Yeah, no, I love some of the things that Devon mentioned there, just in terms of the work at the hospitals, as well, as, having a medical professional speak at your conferences, and vice versa. We have a cardiovascular prevention conference, in the springtime, and, a lot of the talks are on medications, but, some of the issues that we talked about here, in terms of natural exposures, and we could talk about natural benefits, but actually natural risks as well, I think are just as important, for people's long-term health and outcomes here. And so
yeah, and I think we're starting to get, and I don't even want to say starting, I think there's a continuation, because I don't think it's necessarily new, of more rigor around understanding the benefits of nature vis-a-vis health. And I'm going to reference another Nature Conservancy supported study, which was the Green Heart Project in Louisville, Kentucky, which was we also had someone on the podcast back in June discussing this as well. So I'll make sure that's linked in with this one. But they did a longitudinal study in Louisville over 4 square miles, 9 square, I can't remember how many square miles, but large study over many years. And they did greenery in one area and greenery not in the other. And greenery meant trees and shrubs. And they were very smart about how they did it. And, they planted trees in areas where it made sense based on the wind coming off the highway. And they planted in areas where they knew there were idling cars because of drive-throughs. And they found that there was, after about 2 years, that there was a 10% reduction in a biomarker for cardiovascular disease over a 10-year period. And that's just the beginning of that study. And they think it has to do with maybe the immune system and some of the pollens from the trees. I'm probably not getting this 100% right, but I'm trying. They think it could be that. But they're also talk about, well, maybe it was the air in this area where there were benefits. Maybe it was because people were walking around outside more and they were together, and there was the community aspect too. So I think there's more and more of these studies that are starting to get at the scientific basis for why being in nature is so good. And this was the first ever controlled study that was done, which is pretty wild. And then another suggestion, I was at a conference last year with Mount Sinai put on, and one of the presenters there had, I'm curious actually, Dr. Donahoe, your thoughts on this, but on your medical record, your electronic health record, could you attach a map of where you live? And that map could include a picture of air quality, for example. So if you're an asthmatic patient or you might have symptoms, you would actually be able to see, oh, that person lives near the airport and the air quality is generally, X, Y, and Z. So just maybe it's these nudges and tweaks of including a map with your electronic health record that gets you thinking about the physical spaces that people are in. So curious if you have thoughts on that.
Yeah, when we were talking before, and I think Devon used the word, a nature prescription, and I was kind of thinking back about longing for the old days where we had a prescription pad in our pocket and you could sort of, write on the prescription pad, exercise, 10 minutes, 3 times a week. Unfortunately, I'm not sure the EHR, has that in their template, but, hopefully the beauty of this EHR and, a whole other discussion we could talk about is kind of, integration of AI and how that kind of information, because you could think, okay, you have somebody's zip code, that information, should be readily available, right? So the problem, is that, one issue, and health, there's so much data, but hopefully one thing that AI could help us with is kind of harnessing that data. And how do you or integrate that data, to make a meaningful impact on somebody's health, and because there's just, when you start, we're talking about one small area here, you deep dive into, each of these little things. It's just it's very actually exciting, the potential that we have to, reduce people's cardiovascular risk through non-traditional risk factors, I'd say.
Yeah. And some of them being so simple, like just being outdoors, walking around, gardening, something community based. Yeah.
And as I mentioned, kind of, free,
Yeah.
and
free.
And, we worry about cost in healthcare and risk free, essentially, and, applicable to everybody.
Well, thank you both. I don't know if you have any closing thoughts, Devon or Dr. Donahoe, but thank you so much for joining. I think this was really informative and kind of linking these fields together, which we of course knew were connected. That's why you're both here. But I thought this was really interesting in how these interrelationships exist. But any closing thoughts from either of you?
No, this is great. Just thank you so much for helping us to put a voice to these issues. This is great, Carrie. We really appreciate it.
Yeah, no, same, Carrie. I just want to say thank you. I actually learned a lot today. I hope I taught you something as well. And I look forward to keeping the conversation going.
Yeah, likewise. Thank you both.
Thank you so much.
Thanks.